I'm going to draw the kidney pretty large so you get to see what it's like. It's almost like a kidney bean, hence kidney. Or actually I think kidney bean stole it from the kidney because they look like the kidney. The kidney receives circulation from the aorta that travels down from the heart. Part of the aorta will make a vessel and feed the kidney with an artery. This artery branches off throughout the kidney and to the glomerulus. We'll talk about that in a minute. And of course there's one that branches off to the other side. And the aorta will continue traveling down to the legs, which will make the femoral arteries. These will be the legs, or the femoral arteries. And so the aorta does a lot of traveling from the left side of the heart. On the top, we'll talk about cardiac later, but the aorta splits off into carotid arteries. When it comes to the bottom, it splits off to femoral arteries. But anyway, a portion of the aorta splits off into the kidney and supplies the kidney with filtration, with blood, fresh oxygen. And whenever there is an artery, there is going to be something to bring back deoxygenated blood called a vein. Yes, this vein will connect itself, these will be the femoral veins, to the inferior vena cava, and this is the aorta. Okay, so Anatomy 101 accomplished. We have circulation to the kidney, and the basic functioning unit of the kidney is called starts with an N, nephron. We have about, sorry, that's an N. We got about 1 million or so for each kidney. And once these nephrons are damaged, they do not come back. Hence, renal failure. If these nephrons were to replicate themselves, we wouldn't have such thing as renal failure or dialysis. They would simply after damage of the unit, nephron, it would reproduce itself. But in this case, with the nephrons, they don't. Other things that don't reproduce themselves is cardiac cells, hence heart attack leads to heart failure, and brain cells, hence CVA leads to permanent disability most of the time. So we got the nephron, and if I draw a large nephron, it's going to be a cluster of capillary beds. This portion of the nephron is called the glomerulus. The glomerulus does most of the filtering. It filters the blood and performs a filtrate, which will later be known as urine. And this is the loop of Henle, and down into this will drain down into what's called the renal calculi eventually. These fill up with fluid, and when all of these fill up with fluid from the renal pelvis down into the ureter, down into the bladder. Bladder fills up, and then you go to the bathroom. So this is just one of the 1 million nephrons that you have. They all filter the blood, they all produce urine, drain into the renal pelvis right here, and once the renal pelvis fills up, which is usually about 25-30 cc's is capable of holding, it will drain into the ureter and then into the bladder and start filling the bladder up to produce urine. Now, the glomerulus is a very sensitive structure. It's a very thin, semi-permeable membrane structure. This whole convolution of capillaries come from the renal artery. So the renal artery will branch off into a small capillary bed, and that blood is filtrated in the glomerulus. The glomerulus allows certain things in, and doesn't allow large substances in, is what I'm trying to say. It will filtrate the blood. It does not let red blood cells in. You shouldn't have red blood cells in your urine. Red blood cells are too big to fit inside and pass through the membrane of the glomerulus. Large proteins, such as albumin, should not go through the glomerulus. It's too large. Proteins are too large to go through here. So two things you should not have in your urine is proteins and red blood cells, because they're not supposed to be able to permeate through the glomerulus. However, electrons such as potassium, sodium, chloride, magnesium, calcium, phosphorus, those things are small enough to fit through the glomerulus and are able to either be excreted out into urine or reabsorbed into the bloodstream, because the capillaries also surround the loop of Henle and the proximal convoluted tubules and distal convoluted tubules. Those are just fancy words for parts of the nephron. Those parts of the nephron, their job is to reabsorb what we don't want to lose. Our body knows what we need to get rid of and what we don't need to get rid of. And if we're getting rid of too much sodium, our body will keep the sodium in. If we have too much sodium, our body will get rid of sodium. Or our nephron will. So yes, this nephron regulates a lot of electrolytes. If it holds sodium in, it regulates your blood pressure. If the kidney doesn't get enough perfusion, the adrenal gland on the top will secrete something that starts with an A called aldosterone. Yes, aldosterone will circulate into the blood, and what aldosterone does is it holds your sodium, which will attract water, into the intravascular space. The kidney, if it doesn't get enough perfusion, will also secrete a hormone called renin, R-E-N-I-N, renin. And renin, after it goes through a few phases of development, will turn into a very powerful vasoconstrictor called angiotensin II. Renin will turn into angiotensin II because it wants to vasoconstrict and push more blood to the kidney.